have a book that is coming out that speaks to a situation that we all find ourselves in right now, and that is we're isolated from people that we know and love. Many people are forced to stay at home either by themselves or not with the community they're used to. You write in your book about how society is struggling with a new disease, and that is essentially loneliness. What are some of the things people can do to try and maintain their mental health as well as their physical health?
I'm so glad you asked, Trevor, because it's important not just because loneliness makes us feel poorly, but also because we now understand that chronic loneliness is actually bad for our health. It increases our risk for heart disease. It shortens it's associated with a shorter lifespan. But there are things that we can do to ensure that we strengthen social connection. And as hard as this time is, I think that we can potentially come out of it even stronger if we do a few things. So number one, I think it's important that we spend at least 15 minutes a day, if not more, engaged with the people that we love, whether that means video conferencing with them, writing to them, calling them on the phone so we can hear their voice. The second is it's really important that we make that time count. And that means improving the quality of our time with others by decreasing the distractions that we experience during our interactions. So instead of talking to somebody on the phone while you're also scrolling through your social media feed and refreshing your inbox and watching the news on TV, just try talking to them with your full attention. One of the greatest gifts that we can give people is the gift of our full attention. And finally, it's important also to recognize that one of the back doors out of loneliness, if you will, one of the great but hidden solutions to loneliness is service. It's by helping others that we actually take the focus off of ourselves and place it on someone else. It's how we rebuild a connection to someone or establish a new one. And it's also how we remind ourselves that we have value to give to the world. Mm-hmm. Because one of the great prices that we pay when we're lonely is over time we start to buy into the idea that maybe we're lonely because we're not likable. Maybe in some way it's our fault. Maybe this is evidence of some personality flaw. Now, none of that is true. But when we serve other people, we're reminded of how good it feels to connect and that we have something of great value to bring to them and to others around them.
You delivered a TED Talk where you predicted pretty much what is happening now. Now, thanks to the world we live in, that has sprouted a bunch of conspiracy theories, everything from Bill Gates invented this virus to prove himself right, or he knew it was going to happen and that's why he said it. Was that TED Talk about this virus, or was that a hypothetical that has now come true?
Well, I didn't know specifically that it'd be coronavirus and that it would hit in late 2019. But the goal of the talk was to encourage governments to make the investments so we could respond very quickly and keep the case numbers very, very low. And so sadly, this is not a case where, I feel like, hey, I told you so. Mm-hmm. Because we didn't use that time when it was clear as the biggest threat to kill millions of people to have the diagnostic standing by, to be ready to ramp up a vaccine factory. A few things were done. Some countries, our foundation funded some work that will help with the vaccines now, will help with the diagnostics, but most of what was called for, particularly in a New England Journal of Medicine article I did that went into way more specifics than I could in a short TED Talk, those things didn't get done, and so that's why it's taking us a long time to get our act together faced with this threat.
Here's a question I have as an individual. How is it that you, as a non-government, knew this information and knew that it needed to be acted on, and governments and organizations that are specifically tasked with protecting people from this very thing either didn't have the information or ignored it? What do you think happened there? Because I know you interact with governments, you talk to organizations like the CDC, like the WHO. What went wrong?
Well, there are lots of individuals who were as worried as I was. People like Dr. Fauci, who've been through various epidemics. And so when we had Ebola, Zika, SARS, MERS, we were lucky that they didn't transmit very easily. They weren't these respiratory viruses where somebody who's not very symptomatic and is still walking around can spread the disease in some cases to literally dozens of people. So the respiratory transmission, particularly because world travel is so intense, that's where I show the simulation in that speech and say, this keeps me up at night more than even war, which is no small thing. And yet, in terms of being systematic about, okay, let's run a simulation and see how would we reach out to the private sector for tests or ventilators, and what kind of quarantine would we do? And as we enter into this, we haven't practiced at all. And so you can see it's, every state is being forced to figure things out on their own. And it's very ad hoc. It's not like when a war comes and we've done, 20 simulations of various types of threats, and we've made sure that the training, communications, logistics, all those pieces fall into place very rapidly.
You were one of the first people to come out and donate a large chunk of money to fighting coronavirus or helping medical workers get the equipment they need. I remember the last I read it was yourself and your wife Melinda who had pledged over $100 million. It seems though that money isn't able to fix this problem. It seems like governments around the world are trying everything they can, but it doesn't seem like it can be fixed. What are you hoping to achieve in this moment in time?
Well, if we get the right testing capacity, you can change by literally millions the number who are infected. And governments will eventually come up with lots of money for these things, but they don't know where to direct it. They can't move as quickly. And so because our foundation has such deep expertise in infectious diseases, we've thought about the epidemic. We did fund some things to be more prepared, like a vaccine effort. Our early money can accelerate things. So for example, there's, of all the vaccine constructs, the 7 most promising of those, even though we'll end up picking at most 2 of them, we're going to fund factories for all 7. And just so that we don't waste time in serially saying, okay, which vaccine works, and then building the factory. Because to get to the best case that people like myself and Dr. Fauci are saying is about 18 months, we need to do safety and efficacy and build manufacturing, and they're different for the different constructs. And so we'll abandon, it'll be a few $1 billion we'll waste on manufacturing for the constructs that don't get picked because something else is better. But a few billion in the situation we're in, where there's trillions of dollars, that's 1,000 times more, trillions of dollars being lost economically, it is worth it. And normal government procurement processes and understanding which are the right 7, in a few months those may kick in. But our foundation, we can get that bootstrapped and get it going and, save months because every month counts. Things can reopen if we do the right things in the summer, but it won't be completely normal. You'll still be very worried. We may decide masks are important, although right now they're in short supply for health workers, so people should not go and hoard those. But the capacity of that can be brought up, so it may be something that, like China today, everybody who's walking around is wearing one of those. So we'll have a lot of unusual measures until we get the world vaccinated. 7 billion people, that's a tall order, but it is where we need to get to, despite a lot of things in between now and then to minimize the damage.
You predicted this pandemic almost to a T, and maybe it was because we were dealing with other things at the time, we didn't really pay that much attention. Is there anything else you want to warn us about now that we should be looking forward to? Is there anything else that keeps you up at night?
Well, this is a naturally caused epidemic, and as bad as it is, it looks, if you have reasonable treatment, to have a 1% fatality. There could be epidemics that are worse than that, including ones that aren't naturally caused that are a form of bioterrorism. But one thing I feel good about is this is such a big change to the world that this time it won't be like Ebola, which was just there in West Africa or Central Africa. This time, the tens of billions to have the diagnostic standing by, the vaccine manufacturing standing by, this time we will get ready for the next epidemic.
Well, I hope your words are prophetic once again. Thank you so much for your time. Good luck in all of your work, and stay healthy out there. We need you. Right now across America, it seems like there's a huge divide and there's a disconnect in understanding whether or not the federal government should be stepping up or whether or not states should be going at it alone. We know that your state has been asking for supplies. It sounds like your state is not getting the supplies that it needs, but then there are states like Florida where they've gotten 100% of what they've asked for, and they are nowhere near close to being in the situation that your state is in. Does it feel like there are politics at play with regards to what relationship a state has with the president?
Well, all I can say is this, the fact of the matter is it's on all of us to remember that the enemy is the virus. It's not one another. It's not the federal government versus the states. My experience is similar to that of a lot of other governors, and Republican and Democratic, frankly, that we're not getting as much as we hope to from the federal government. And so we've got to supplement that by contracting with anyone we can find masks from or test kits from. And we're ending up bidding against one another. And it's really a destructive way about going, to fix this problem. A national strategy with a national buying power that actually ensured everyone had equitable access to what we need when we need it would be the wisest thing to do. But we're in this situation, and like governors across this country, I'm going to do everything I can. So whether it is working with businesses inside Michigan, like the big three who are stepping up to start producing components to ventilators, we're going to see, the arsenal of innovation is going to be right here within our borders, but we've got a lot of work to do. The unfortunate thing is our need is right now. We have a need for not just PPE, but for volunteers. We're looking for people to come into Michigan and help us meet our need. And, any of your viewers who are interested in that can go to michigan.gov/fightcovid19 and join the fight with us, because it's got to be all hands on deck. And we are a hot spot right now.
It's hard to talk with you or speak with you and not ask you about the comments the president made about you. I think you have a shirt that might be exactly that woman from Michigan. An extremely dismissive statement, and one that sparked a conversation across the country, where Trump flat out said, if you are not nice to him, he will not help you. I believe that Vice President Mike Pence still called you. Is it difficult for you during this period to be dealing with politics whilst at the same time trying to deal with a crisis?
I don't think any of us has energy to deal with politics right now. All of our energy, all of our focus has to be on meeting the needs of our people. People are dying. Every day we are announcing, the additional people that have tested positive for COVID-19, the number of lives that are lost. Those are stories. Those are people who leave loved ones and family. Those are people who relied on a healthcare system to meet their needs, and frontline providers who put their own health at risk to take care of others. I don't have any time to think about fighting anything other than COVID-19, and that's precisely why I say let's not fight one another. We are not the enemy. This virus is.
You are an infectious diseases expert who has advised 6 presidents on everything from SARS to Ebola to the HIV epidemic and Zika. I have 4 questions because I know we're going to run out of time, but I just want to let you know I have 4 questions that I think are really important. Number 1, we hear about this clock, 15 days, where things will be reassessed, 15 days where people might go back, 15 days, every country, 21 days. There seems to be a clock. My question is, what is that clock supposed to be, and is there a certain amount of time that people can be away from each other where coronavirus goes away? And the follow-up in that same question is, does the clock start if people are not completely quarantined during that period?
Yeah, the virus is the clock, Trevor. So people say, may arbitrarily, well, in 2 weeks, we're going to be okay. It depends on the kinetics of the outbreak. Right now, take New York City. They are getting hit really hard, and the kinetics of the outbreak is going there. You can't predict when it'll make that turnaround and start coming down. In general, if you look historically at countries that have been through the whole cycle, in China, it was about 8 weeks or so before it went way up and then way down. In Korea, the same thing. So if you look at each individual country, and being a big country as we are here in the United States, we're almost like a lot of little countries. Like New York in itself can be considered a country. California can be considered a country. So it's unpredictable about when you can say this cycle. It's usually measured in several weeks. Sometimes when you're into the cycle, you may only be 2 to 3 weeks away before it starts to turn around.
Right. Okay, so then to that point, that's then my second of the 4 questions. Second question is New York City really harder hit, or is New York's testing making the numbers spike up, and is this something that we're going to see start trending throughout America?
Well, there are a couple of good questions right in there. New York is more hardly hit for sure. The nature of the city, the crowding of the city, the fact that you get the beginning of your outbreak when you get influx from other countries. China was the index country that came in. New York is a travel hub of the country. So clearly we had a lot of cases come in. By the time they realized what they were dealing with, they had already gotten a sucker punch. And they really were playing catch up. They didn't do anything wrong. They're not very different except that they're a big, robust city. And because of that, they're getting hit hard.
Okay, and then the second last question is with regards to reinfection and immunity. We talk about people who have it and are asymptomatic. We talk about people who are recovering, and we're starting to see those numbers grow around the world. Do we know yet if getting corona and surviving corona means that you're now immune to the disease, or is there a chance of reinfection?
We don't know that for 100% certain because we haven't done the study to see re-challenges, whether they've been protected. But I feel really confident that if this virus acts like every other virus that we know, once you get infected, get better, clear the virus, that you'll have immunity that will protect you against reinfection. So it's never 100%, but I'd be willing to bet anything that people who recover are really protected against reinfection.
Okay, and then our final question, and thank you so much for your time. I really hope everyone understands how important it is to listen to you. Final question with regards to the government, the CDC, the NIH, and all of the units working together. Right now, it feels like there is a push and pull, a tug of war between states and the federal government, etc. For Americans who are out there watching this, what is the plan, and what do you think needs to happen for the whole unit of the United States to fight the coronavirus, implementing different checks and balances along the way to make sure that everyone fights it and the numbers go down?
Well, that's a very good question. Things are implemented at the state and local level. That's the way this country works so well. The federal government is a facilitator, it's a supplier, it's a supporter. And that's the way things should be going. And that's what we're starting to see now as we are catching up on things that weren't done so well in the beginning. We now have many, many more tests. The private industry is getting involved. The government's not making the test, the private industry is. The ventilators that are needed coming out of the stockpile, yet companies are starting to make more. So it really is a marriage between the federal government as the facilitator and supporter of where the real action is at the state and local level.
Thank you so much, Dr. Fauci. You've been amazing. I could talk to you for an hour on this, but I know everyone wants your time. Good luck with what you're doing, and I hope we're doing our part to make your job a little bit easier. Thank you.
You are very much, and I appreciate the opportunity to speak with you.
Stay safe and wash your hands because of that fake cough you did.
Take care.
One of the most confusing conversations happening right now in America is the battle between governors/states and the president/the federal government. In your opinion, where is the federal government falling short, and where do you think states need to step up and do more to fight this pandemic?
We have not received any ventilators in a state of 40 million to meet our needs. There were 170 ventilators that went directly to LA County. Just a couple of days ago, they opened the boxes and found out that none of them worked. So rather than complaining about it, we decided to ship them from LA. I brought them into Silicon Valley, and literally within 72 hours, all of them were fixed, and they've already been sent back down to Los Angeles. It's a way of making this point and answering your question. We're not waiting around for the federal government. We need more support. But at the end of the day, we have to be resourceful in our mindset and our approach and use all the tools in our toolkit. All of that being said, I want to thank the president in this respect. We got that USNS Mercy, that large hospital ship, 1,000-bed capacity into LA a couple of days ago. And that's the kind of thing we do count on the federal government for. Beyond that, we're going to be as resourceful as we can be.
One of the things you were given credit for is being one of the governors who acted earliest with regards to the coronavirus. You know, you told people over 65 to stay at home. You then implemented a lockdown before many other states did. You've still come out and said you are worried that up to 25 million Californians/Americans could get the coronavirus. How do you think you are looking right now? Do those numbers still look as dire, or do you think that you've done enough to stave off the pandemic from growing?
Well, good enough never is. You don't run the 90-yard dash on this. And I think the biggest mistake we can make is having done all of this good work, the stay-at-home orders, having people practice safe physical distancing. I prefer physical distancing to social distancing because a lot of young folks are confused by social distancing when they're all socially connected, but we need them physically apart. The fact that we're practicing that at scale, we think has bought us time. But we're not out of this by any stretch of the imagination. Let me be specific. In just the last 4 days, we have tripled the number of people in our ICUs. We've doubled in the last 4 days the number of people in our hospital system. But we do believe that early call on stay-at-home and physical distancing bought us a few days, maybe a week or two, that allowed us to start getting our resources in place to meet the moment.
Before we go, is there anything you would like the public to do? Is there anything people can help officials with? Because we always ask from the top down, but what can we be doing to help in this situation?
There's nothing more potent and powerful than the tool at hand for every single person watching, and that's practicing physical distancing. You know, not going to the beach or playgrounds or parks when tons of other people are out there, not going on a jog when those jogging paths are full. If we do that, there's nothing more significant to bend the curve, and that's heroic. Everybody has the capacity. It's decisions, not conditions, that are going to determine the fate of this virus. And so when you're reading all of these programs or watching programs that say, here's what's going to happen, that's nonsense. Nothing is predetermined. We have the capacity to bend the curve by making better decisions. And so please practice physical distancing and don't buy for a second that we can cut the parachute before we've landed.
Governor Newsom, thank you so much for your time. Good luck out there.